Hi everyone. Today I'm going to explain how to take blood sample.
The act of taking blood sample from a patient is called phlebotomy, and the person who takes the bloods known as phlebotomist. There are many steps while taking the blood.
Step 1. First, gather all equipment: gloves, tourniquet, needle, syringe or vacutainer. Step 2. Patient preparation. Confirm the patient's identity, explain the procedure, and make sure they are comfortable. Step 3. Hygiene. Perform hand hygiene and wear gloves. Step 4. Tourniquet. Apply the tourniquet about 3 inches above the site and ask the patient to make a fist. Step 5. Choose the vein. Select a suitable vein, preferably the median cubital vein. Step 6. Clean the site. Clean the area with an alcohol swab and let it dry. Step 7. Insert needle. Stretch the skin, insert the needle at a 15 to 30 degree angle, and attach the tube if using a vacutainer. Step 8. Collect sample. Allow the tube to fill. Follow the proper order of draw if taking multiple samples. The standard order of draw for phlebotomy is blood culture, yellow or blood culture bottles if needed, coagulation tube, light blue sodium citrate, serum tube, red or gold top, no additive or clot activator, heparin tube, green sodium lithium heparin for plasma chemistry, EDTA tube, lavender or purple K2-EDTA for CBC, chemistry, etc., oxalate or fluoride tube, gray for glucose. Follow your lab's specific guidelines because some facilities swap or omit certain tubes. Always fill each tube to the indicated fill line and invert gently after collection. Step 9. Finish up. Release the tourniquet, withdraw the needle, and apply pressure with gauze. Step 10. Safety and labeling. Dispose of the needle in a sharps container and label the tubes immediately. That's how you take a blood sample safely and correctly. Like and subscribe Rescue Medic for more medical skills.